Representative Meeks, you're recognized for a question.
Thank you, Mr. Chair. My question, the numbers you gave, 187,000 eligible, 172,000 enrolled. How many are actually receiving coverage as of either June 1st or July 1st? Do you have that number? That actually have cars in hand?
Yes, the 172,000 are those who actually have completed the process, should have cards in hand and be enrolled.
Okay, so, and we know that there is some lag time between the time that they actually get the cards and they're actually, or they enroll and actually go to the doctor. And I know there's that period of Medicaid in there. Are we keeping track of how those people are using the system? I mean, are we seeing a spike in our Medicaid dollars? And I think you said before that that's still at 100%, but eventually Arkansas is going to end up being on the hook for some of it. Are we keeping track of that period of where they're getting Medicaid?
Of course, the portion, let's say 2017, the portion we'd be on the hook for will be the same whether they're in that kind of interim Medicaid period or on the private sector. So there's not really a distinction there. I don't have that data in front of me of what their usage is during that brief period. It's something we probably can track. It's obviously pretty fluid because some people are on just very briefly, some are a little bit longer. But ultimately, the payment, it really doesn't matter in terms of what at some point how much we would pay.
Right. Well, again, it's kind of in my head. The data is: are these people getting these cards and then running out to the doctor again? You know, using the Medicaid portion of it and not waiting until the actual private insurance kicks in. And that, again, that would be usage of the system, you know, educating the folks along those lines to make sure that they are using the system properly. Because, you know, if somebody in the private sector, they get insurance, you know, technically they don't get, their insurance doesn't kick in, so they have to wait. So I think it's kind of an educational type deal, and then also proper usage of the system.
I think that's right. I mean, one of the reasons we do the Medicaid coverage right away is we don't want to put an unfair burden on the carriers of having someone who today realizes they're sick and decides to finally go sign up. The education part of it, as you said, we want them to sign up before they ever get sick. We want them to sign up for healthy, start paying their premiums, already have their Blue Cross or Wall Force or Sympathy card, never need Medicaid services. There will be some, though, who, for whatever reason, I mean, it hasn't developed, so you just kind of delay, and then you realize you need something, then you go to sign up quickly.
If I can add, for the folks going into the private option plans, they get a Medicaid number for the 40 days or 30 days that they're kind of in the enrollment process. They do not get a Medicaid card. So the number covers them if they have an emergency or something like that. The first time they get their card is when the carrier mails them their insurance card. So I think, well, I understand your concern. Most of the folks may not even think they have insurance
Until that card comes.
Okay.
Are you hearing any notes of people having trouble finding doctors? Because I know at the beginning there was confusion that, you know, even though it's a private option, it's private insurance or whatever, that some people were having trouble finding doctors because they thought it was Medicaid, and maybe some doctors thought these people, and of course, doctors are taking less and less Medicaid patients, or it seems like it anyway. So
I have heard of very few anecdotal cases where people are struggling to find a physician. What I've not heard is what seems to be happening in some other states where they simply expanded regular Medicaid. Those Medicaid recipients who have a Medicaid card are finding it difficult to get someone to cover them because there are many providers in other states who don't serve Medicaid at all. Here, because they're getting a private sector card, I think they're finding it much easier to get coverage. But I'm sure there are some people, depending on where you live, who's got service that you're still going to have trouble finding a carrier and finding a provider or finding someone who can see you as quickly as you'd like to.
and that dovetails into my next question. Those who are on Medicaid currently, are you starting to see less and less doctors take Medicaid because of the influx of private option patients? Because doctors can only take so many patients, and Medicaid seems like it's kind of on the lower end because of mainly because of the payment.
At this point, we haven't heard that, and one thing I would add is that through Medicaid, it's actually federally funded, but there was a primary care rate increase that recently went through. And we've actually heard a lot of feedback from primary care providers that has actually helped them to be able to continue serving Medicaid clients and also to be able to increase that, since now the rates are much higher than they have been in the past.
And I guess you're doing this just by anecdotal evidence. Do you survey providers? Do you kind of take a look at the data maybe and see that, you know, I don't know how, when you start getting all this data in and you surveys, how would you quantify that basically, or can you quantify that?
So part of the evaluation requirements of the waiver is to compare the experience that individuals get in the private carrier plans with the experiences that the individuals get in the traditional Medicaid plan, to see what the value was, if this cost marginally more, what the value was that was gained by the private option strategy. In that, we will look at both consumer surveys, both Medicaid and private option. We'll look at the utilization of care, how many visits to primary care visits per 1,000, how many specialty visits per 1,000 on each side. And we'll look at some clinical quality indicators about what the quality of care was, as well as the networks of providers between the commercial plans and Medicaid. So that, I think, is going to be the direct answer to your question. That's required of us by the feds. They want to know that we're not just giving money to commercial insurance carriers, that we're getting some value for low-income individuals out of that. And I think that's what we're going to systematically be able to answer your question.
Can I just add, Representative Meeks, if we were talking about the family practice physicians, primary care physicians, they did get a bump in Medicaid up to Medicare rates that's fully funded by the federal government for 2 years. One of the policy decisions we and the members of the legislature will have is whether to keep that rate increase in place. It's possible the federal government will decide to continue it at their cost. If they don't, for your information, for our Medicaid program to keep that rate increase in place will cost us about $10 million a year in state funding. So no decision needs to be made now, but just one of those decisions that'll be on the table for us if the federal government doesn't decide to continue it is, do we want to keep paying those PCPs the same price that Medicare pays them for an office visit?
We're still at about 70-30 match rate.
About 70-30, that's where the $10 million comes from. That'd be our 30%.
Okay. All right. Thank you, Mr. Chair.